When the skull is viewed from below, the view is called the norma basalis. For the convenience of description, the undersurface of the skull it is divided into three regions: anterior, middle, and posterior, by two imaginary transverse lines. So norma basalis is divided into three regions by two imaginary horizontal lines, which are called the anterior transverse line and posterior transverse line. Let's draw the lines. First, the anterior transverse line. The anterior transverse line passes along the posterior free margin of the heart palate. This is the heart palate. Along the posterior free margin, along this margin, the first imaginary transverse line or anterior transverse line is passing. So that is the anterior transverse line. And the posterior transverse line, the second one, it passes along the anterior margin of foramen magnum. So let's draw the posterior transverse line. This one, posterior transverse line, it passes along the anterior border of foramen magnum. This is the foramen magnum. This is the outline of foramen magnum. It is the largest foramen of the skull, foramen magnum. Obviously, these two imaginary horizontal lines divide the norma basalis view into three parts: the first part, second part, and third part, or anterior part, middle part, and the posterior part, respectively. Anterior, middle, posterior. First, we will discuss about the anterior part of norma basalis. The anterior part of the norma basalis consists of heart palate and alveolar processes of the maxillae. So, what is the feature in the anterior part? First, the anterior part. Okay. What do we get to see in the anterior part? We get to see two things, two features. Number one, the alveolar arch. Number one, alveolar arch. And number two is heart palate. Heart palate. Okay. So what is alveolar arch? Alveolar arch is a U-shaped ridge of bone which is formed by the union of the alveolar processes of two maxillae from two sides. Now the alveolar process of the two maxillae on both right and left side are like this. This is alveolar process of maxilla of one side. Okay, this is the alveolar process of maxilla of the opposite side. These two alveolar processes together form a U-shaped ridge. U-shaped ridge of bone, and that is called the alveolar arch, and it bears the sockets for the roots of upper teeth. So alveolar arch, it bears the socket for roots of upper teeth. The next feature is the hard palate. The hard palate is contained within the alveolar arch, and it is formed by two pairs of bony processes. So hard palate, this is outline of hard palate. It is formed by two pairs of bony processes. Number one, palatine processes of maxillae in front, forming the anterior two-third. So anterior two-third is formed by palatine processes of maxillae. This is the palatine process of one maxilla, and it is palatine process of another maxilla. Palatine process of maxilla. Okay. It is relevant to know here that maxilla, which forms the upper jaw, is made up of a body and four processes. So maxilla has got four processes, and the processes of maxilla are as follows. Number one, it has got a frontal process. Number two, the zygomatic process. Frontal zygomatic, number two. Number three is the alveolar process, and number four, last but not the least, it is the palatine process of maxilla. The last two, the alveolar and palatine, are discussed in relation to the norma basalis of the skull. The alveolar process took part in formation of the alveolar arch, and the palatine process of the maxilla we are discussing now, they take part in formation of the anterior part of the hard palate. Okay. So anterior two-thirds of the hard palate is formed by the palatine process of maxilla. And the posterior one-third is formed by the horizontal plates of palatine bones. So this part is formed by horizontal plates of palatine bones behind. Plates of palatine bones. So that's why hard palate presents four sutures in between these processes: intermaxillary, interpalatine, palatomaxillary sutures. So what are the sutures that are seen in the hard palate? Sutures in between the palatine process of two maxillae, we get to see the intermaxillary suture in the anterior two-thirds of the hard palate. Then in between the horizontal plates of palatine bones, which form the posterior one-third of the hard palate, we get to see the interpalatine suture. And in between the palatine process of maxilla of one side and horizontal plate of palatine bone of that side, we get to see the palatomaxillary suture. So sutures are: number one, intermaxillary suture. in between the palatine processes of maxilla. Number 2, interpalatine in between the horizontal plates of palatine bones. And number 3, palatomaxillary. The last one is between the palatine process of maxilla of one side with the horizontal plate of palatine bone of that side. Okay. Now the hard palate should be described in the detail because it's a very important structure. The hard palate that is formed by these processes is actually a partition between the nasal and oral cavities. Okay, let's clear out. This hard palate is a partition. Hard palate. It is a partition between the nasal and oral cavities. How it is formed, it has been described already. Now, the inferior surface of the hard palate presents the following features. Number 1 is the incisive fossa. A small pit anteriorly in the midline behind the incisor teeth. These are the incisor teeth. A pair of medial incisors, a pair of lateral incisors. So this is the incisive fossa. A small pit anteriorly in the midline behind the incisor teeth, into which the incisive canals open. Now, each incisive canal or foramen, there are 2 of them, right and left. They pierces the corresponding side and ascend into the corresponding nasal cavity. So, the right incisive foramen and the left incisive foramen, they pierce the right and left side of the incisive fossa, and the incisive foramen transmit the terminal parts of the nasopalatine nerve and greater palatine vessels. Okay. So these are incisive canal or foramina which open into the incisive fossa. Okay, incisive canal or foramina are opening into the incisive fossa, and they are transmitting 2 things. Number 1 is the nasopalatine nerve, and number 2 greater palatine vessels. So that is about the incisive fossa. Next feature is the greater palatine foramen. Greater palatine foramen, one on each side, lies in the posterolateral corner of the hard palate, medial to the last molar teeth. This is the last molar teeth. Last molar, medial to the last molar, lying on the posterolateral corner of hard palate is the greater palatine foramen. So this is the outline of greater palatine foramen. Okay, greater palatine foramen. Greater palatine foramen. It transmits the greater palatine nerve and vessels. Greater palatine nerve and vessels. Okay. Then we get the lesser palatine foramina, 1 to 3 on number on each side, which are present in the pyramidal process of the palatine bone, and they are located just behind the greater palatine foramen. So just behind the greater palatine foramen are 1 to 3 numbered lesser palatine foramen, and they are processed in the pyramidal process of palatine bone. This is the lesser palatine foramen. Lesser palatine foramen, they are present in the pyramidal process of palatine bone. Okay, lesser palatine foramen. Right. Then we get the posterior nasal spine, which is a conical projection in the median plane on the sharp free posterior border of the hard palate. This is the posterior nasal spine. Posterior nasal spine. Okay, posterior nasal spine. It is a conical projection in the median plane on the sharp free posterior border of the hard palate. Next is the palatine crest. Palatine crest is a curved ridge. Let's see the palatine crest. It is a curved ridge. This is a palatine crest near the posterior border of the hard palate, parallel to the posterior border of hard palate. Okay, so that is called the palatine crest. Palatine crest. So that in short sums up the important features of the hard palate. Next we go on to the middle part of the norma basalis. Let's discuss the middle part of norma basalis. The middle part extends from the anterior transverse line to the posterior transverse line. The anterior transverse line passes along the posterior margin of hard palate. Passes along the posterior margin of hard palate and the posterior transverse line. It passes along the anterior margin of foramen magnum. In between them lies the middle part. The middle part consists of a median region and two lateral regions. So we get a median region like this, and two lateral regions. Let's discuss the median region and lateral regions one by one. Let's clear out. First, the median area. Okay. The median area presents the posterior border of vomer. It is the posterior border of vomer. Number 1, posterior border of vomer. The posterior border of vomer, it separates the two posterior nasal apertures, which are known as the choani in plural. So on both sides of the posterior border of vomer, there are the two posterior nasal apertures. Posterior nasal opening or apertures known as choani. Choani is a plural term, in singular choana. Then next to it is a broad bar of bone. Let's draw the broad bar of bone like this. A broad bar of bone, which is formed by the fusion of body of sphenoid and basilar part of occipital bone. So this broad bar of bone it is formed by the basilar part of occipital bone. It is hereby to be noted that occipital bone is composed of basilar part, condylar part, squamous part, three parts around the foramen magnum. The part which lies in front of the foramen magnum is the basilar part. So let's draw the basilar part. This is the basilar part of occipital bone lying in front of the foramen magnum. So that is the basilar part of occipital bone or basi-occiput. So broad bar of bone is formed by the union of basi-occiput plus in front of the basi-occiput, that is the body of sphenoid. Body of sphenoid. So part of the body of sphenoid is actually takes part in formation of the broad bar. Actually the posterior part of the body of the sphenoid is taking part in formation of the broad bar. So body of sphenoid, this part is the body of sphenoid. Together the body of sphenoid and the basilar part of occipital bone constitute the broad bar. So that is about the median region of the middle part of norma basalis. Now we will shift on to the lateral area and we will look at how the lateral area looks. The lateral area presents pterygoid processes. Now to clearly understand the lateral region, let us shift on to a colored diagram. So if this is the last molar teeth, bind the last molar teeth at the junction of the body and greater wing. What is the outline of the body? The outline of the body is roughly like this. This is the outline, rough outline of body of sphenoid. And this is the outline of the greater wing of sphenoid. Okay. Greater wing of sphenoid. Okay. Now at the junction of body and the greater wing of sphenoid, the pterygoid process come out. The pterygoid process project downwards from the junction between the body and greater wing of sphenoid behind the last molar teeth, and after it comes out, it divides into two plates, the medial and lateral pterygoid plates. there are two plates, medial and lateral pterygoid plates, which are derived the pterygoid process, which project downward from the junction between the body and greater wing of sphenoid. So now let us draw the medial and lateral pterygoid plate. This is one pterygoid plate, this is another. So which one is present on the medial side? This is the medial pterygoid plate, and the rest is the lateral pterygoid plate. So two pterygoid plates are projecting downward from the junction between the body and greater wing of sphenoid behind the last molar teeth, and they are separated. These two pterygoid plates, medial and lateral, they are separated by a gap between them. This gap is known as the pterygoid fossa. Pterygoid fossa. Okay. So it is the medial pterygoid plate, this is the lateral pterygoid plate, and in between them the gap is called the pterygoid fossa. The upper end of the posterior border of medial pterygoid plate, it encloses a triangular depression which is called the scaphoid fossa. If we trace the posterior border of the medial pterygoid plate, this is the posterior border. The upper end of the posterior border, it encloses a fossa which is called the scaphoid fossa. And the lower end bears a hook-like process which is known as pterygoid hamulus. In the lower end, it presents a hook-like process. It is called pterygoid hamulus. Pterygoid hamulus. Okay. Next to the pterygoid plates, the lateral area, lateral region, presents the infratemporal surface of greater wing of sphenoid. The infratemporal surface of greater wing of sphenoid. This is the infratemporal surface of greater wing of sphenoid, and it presents four margins. Number one, the anterior margin. Number two, the anterolateral margin. Number three, the posterolateral margin. And last is the posteromedial margin. It is the posteromedial margin that articulates with the petrous part of the temporal bone. This is the petrous part of the temporal bone, a triangular bony projection from the temporal bone. So that petrous part of the temporal bone articulates along the posteromedial margin of greater wing of sphenoid. There are four foramina, all are located along the posteromedial margin. There are four foramina, all are located along the posteromedial margin. This is the posteromedial margin. What are the foramina? Number one is foramen ovale. Foramen ovale is a large oval foramen which is anterolateral to the upper end of posterior border of lateral pterygoid plate. Now this is the foramen ovale. Then we get behind and lateral to the foramen ovale is foramen spinosum, a small circular foramen at the base of spine of sphenoid. This is foramen spinosum. Foramen spinosum. The foramen spinosum is situated in relation to the base of the spine of sphenoid. Spine of sphenoid is a small, sharp, bony projection that is situated posterolateral to the foramen spinosum, and it is present at the junction of posterolateral and posteromedial margin of the greater wing of the sphenoid. Two nerves are related to the spine of sphenoid: the auriculotemporal nerve on the lateral aspect and the chorda tympani nerve lie on its medial aspect, and both these nerves would be damaged following fracture or necrosis of the spine, and this will cause decreased salivation and loss of taste sensation. Apart from it, we get a very small foramen, canaliculus innominatus, in between the foramen ovale and spinosum. Canaliculus innominatus, and the emissary sphenoidal foramen or foramen of Vesalius, and emissary sphenoidal foramen. Emissary sphenoidal foramen or foramen of Vesalius. It is sometimes present between the foramen ovale and scaphoid fossa. Okay. So we get all these four foramen, 1, 2, 3 and 4 along the posteromedial margin. This is the posterolateral margin, and this one is the posteromedial margin. Right. The foramen ovale transmits the following structure, which can be remembered by the mnemonic MEL: M for mandibular nerve, A for accessory meningeal artery, L for the lesser petrosal nerve, and E for emissary vein connecting the cavernous sinus with the pterygoid plexus of veins. The foramen spinosum transmits the middle meningeal artery, the meningeal branch of mandibular nerve or nervus spinosus, and the posterior trunk of middle meningeal vein. The inferior surface of petrous part of the temporal bone is triangular in shape, with its apex directed forward and medially. It lies between the greater wing of sphenoid and the basiocciput. Its apex is perforated by the upper end of carotid canal, and the apex is separated from the sphenoid by the foramen lacerum. The inferior surface is perforated by lower end of carotid canal posteriorly. The carotid canal runs within the petrous temporal bone. The foramen lacerum is a short white canal, and it is bounded posterolaterally by the apex of petrous temporal, medially by the basiocciput and the body of sphenoid, and anteriorly by the root of the pterygoid process and the greater wing of sphenoid. The tympanic part of the temporal bone also called the tympanic plate, is a triangular curved plate which lies in the angle between the petrous and squamous parts of temporal bone. Its apex is directed medially and lies close to the spine of sphenoid. The base or lateral border is curved, free and roughened. Its anterior surface forms the posterior wall of the mandibular fossa. The posterior surface is concave and forms the anterior wall, floor and lower part of the posterior wall of the bony external acoustic meatus. Laterally, it forms the anterolateral part of the sheath of the styloid process. Posterior part of norma basalis. The posterior part of norma basalis in the median area shows the following structures from before backwards. Number 1, the foramen magnum. This is the outline of foramen magnum. Foramen magnum. Magnum means great in Latin, and it is the largest foramen of the skull. It opens upwards into the posterior cranial fossa and downwards into the vertebral canal. It is oval in shape. Being wider behind than in front, where it is overlapped on each side by the occipital condyles. So you can see the oval outline of the foramen magnum, and in front it is partly overlapped by the occipital condyles. Okay, so the boundary is like oval, and in the front, if we look at the outline, it is partly overlapped on each side by the occipital condyles. Now the foramen magnum, which is the largest foramen in the skull, it gives passage to a number of structures. So if we look at this picture, you can see that all these structures are passing through the foramen magnum. This is the outline of foramen magnum. And all the following structures are passing through the foramen magnum. Through the narrow anterior part, passing a number of ligamentous structures, membranes and ligaments. Number 1 is the apical ligament of Dens. Apical ligament of dense. Number 2, vertical band of cruciate ligament. Vertical band of cruciate ligament. And number 3, membrana tectoria. Membrana tectoria. So these three structures pass through the narrow anterior part. This is the anterior segment of the foramen magnum. Now through the wider posterior part, the following structures pass. The lowest part of the medulla oblongata along with the 3 meninges. This is the medulla oblongata. We can see the cross section in this diagram, and it is covered by all the 3 meninges: dura arachnoid mater and pia mater. The dura arachnoid mater is this covering, dura plus arachnoid, and immediately outside the medulla oblongata lying the pia mater. Dura arachnoid mater and pia mater. Through the subarachnoid space, which is present between the arachnoid and pia, that is this space. This is the subarachnoid space. Through the subarachnoid space, the following structures are passing. First one, the spinal arteries. Anterior spinal artery, one in one single, and a pair of posterior spinal arteries. So let's see. This is the anterior spinal artery, single, lying in the median plane, and posterior spinal artery, 2 in number. Lying posterolateral to the medulla oblongata. Posterior spinal artery. Then the vertebral arteries, one on each side. Vertebral arteries. And last but not the least, the spinal accessory nerve. There is a spinal accessory nerve. So we can see that through the anterior compartment of the foramen magnum, the membrano-ligamental structures are passing, while through the posterior wide compartment of the foramen magnum, the neurovascular structures are passing. So that is about the structures passing through the foramen magnum. Now next, we again go back to the first diagram and concentrate on the features that are seen in the median area of the posterior part of Norma basalis. Behind the foramen magnum, we can see the external occipital crest. Let's draw. This is the external occipital crest. It begins at the posterior margin of the foramen magnum and ends posteriorly and above at the external occipital protuberance. So beginning is from the posterior margin of foramen magnum and ending is at the external occipital protuberance. The external occipital protuberance is a projection located at the posterior end of the external occipital crest. It is easily felt in the living in the midline at the point where the back of the neck becomes continuous with the scalp. Next are the nuchal lines. The superior nuchal lines begin at the external occipital protuberance this is the external occipital protuberance. This is the superior nuchal line. They begin at the external occipital protuberance and the inferior nuchal lines at the middle of the crest. If I draw the external occipital crest once again, the inferior nuchal lines are beginning at the middle. Inferior nuchal lines. Okay, so we get a pair of nuchal lines, superior and inferior nuchal lines. Both of them curve laterally and backward, and then laterally and forward. Basically, they are arching. Both of the nuchal lines are arching laterally. Sometimes or occasionally, there may be the finding of highest nuchal line, and if they are present, they are seen above the superior nuchal line. So if the highest nuchal line is present or supreme nuchal line, it is present above and parallel to the superior nuchal line, and it is called highest nuchal line if present. Now, as regards the attachment of the nuchal lines and the associated structure, the upper part of the external occipital protuberance as well as the superior nuchal line, the medial 1/3 of the superior nuchal line, gives origin to the trapezius. So let's draw the trapezius. Upper part of the external occipital protuberance and the medial 1/3 of the superior nuchal line. This is the origin of the trapezius. Okay. Origin of trapezius. Right. Lower part of the superior nuchal, lower part of the external occipital protuberance, lower part of the external occipital protuberance gives attachment to the upper end of ligamentum nuchae. Okay. So lower part of the external occipital protuberance gives attachment to the ligamentum nuchae. As regarding the lateral part of the superior nuchal line, the lateral part of the superior nuchal line provide insertion to the sternocleidomastoid above and to the splenius capitis below. Okay, sternocleidomastoid above and splenius capitis below. Sternocleidomastoid above and splenius capitis below. So that is about the attachment associated with the external occipital protuberance and the superior nuchal line. The highest nuchal lines, if they are present, they provide attachment to the epicranial aponeurosis medially. Let's see, highest nuchal lines, they are giving the attachment to the epicranial aponeurosis medially. Epicranial aponeurosis, and give origin to the occipitalis or occipital belly of occipitofrontalis muscle laterally. Occipitalis or occipital belly of occipitofrontalis muscle laterally. Okay. Occipitalis or occipital belly of occipitofrontalis. Okay. In case of absence of highest nuchal lines, these structures are attached to the superior nuchal lines. That means if the highest nuchal line is not found, if not present, then the epicranial aponeurosis and occipital belly of occipitofrontalis are having their attachment onto the superior nuchal line. Now, there are presence of muscle in between the nuchal lines. Okay. Now, the area between the superior and inferior nuchal lines provide insertion to muscles medially to the semispinalis capitis and laterally to the superior oblique. So the area in between the superior inferior nuchal line provide attachment to muscles. What are the name of the muscles? Semispinalis capitis medially. The name is semispinalis capitis. And lateral to the semispinalis capitis is the superior oblique muscle. Laterally, superior oblique muscle laterally. Okay. The area below the inferior nuchal line provide attachment medially to the rectus capitis posterior minor and laterally to the rectus capitis posterior major. So we go below the inferior nuchal line and we get the following two muscles: medially one laterally. The name of the medial muscle is Rectus capitis posterior minor. So medially is present rectus capitis posterior minor. This one, rectus capitis posterior minor, and this one, rectus capitis posterior major. Rectus capitis posterior major. Okay, so these are the important muscles which are seen in relation to the posterior part of the norma basilis. Now we come back to the bony features. Now on the lateral part of the foramen magnum, lateral to the foramen magnum, first we get to see the condylar part of the occipital bone on the anterolateral part of the foramen magnum. The condylar or lateral part of the occipital bone presents the following. First, a pair of occipital condyles. The occipital condyles are oval in shape and are situated on either side of the anterior part of foramen magnum. Occipital condyles, oval and present on each side of the anterior part of foramen magnum. Their long axis is directed forward and medially. If we look at the long axis, it is directed forward and medially. They articulate with the superior articular facets of the atlas vertebra to form the atlanto-occipital joint. So, occipital condyles are forming the atlanto-occipital joints. Okay. Now, the hypoglossal or anterior condylar canal pierces the bone anterosuperior to the occipital condyle. So, anterosuperior to the occipital condyle, we get the hypoglossal or condylar canal. There lies the hypoglossal canal. And is directed laterally and slightly forwards. Then we get the condylar or posterior condylar canal, which is occasionally present in the floor of a condylar fossa. This is the condylar fossa, a sort of depression behind the occipital condyles. In the floor of the depression, there is sometimes the presence of posterior condylar canal. Posterior condylar canal. So, hypoglossal canal is basically the anterior condylar canal. Lateral to the occipital condyles, we get the jugular process of occipital bone, which lie lateral to the occipital condyle and form the posterior boundary of jugular foramen. This is the jugular process of occipital bone, quadrangular process on the side of occipital condyle on both the sides. Jugular process and forms the posterior boundary of jugular foramen. Let us draw the jugular foramen. This is the jugular foramen. So the posterior boundary of the jugular foramen is formed by the jugular process. Now, the squamous part of the occipital bone is marked by the superior and inferior nuchal lines mentioned above. So, both the superior and inferior nuchal lines form part of the squamous part of the occipital bone. It is basically lying behind and above the foramen magnum. With respect to foramen magnum, there are actually following three parts of the occipital bone. In front of the foramen magnum, there is the basilar part of the occipital bone, which is known as basi-occiput. That is the basilar part of occipital bone. On both sides of the foramen magnum is a condylar part containing the two jugular processes, and behind and above the foramen magnum lies the largest squamous part. So occipital bone have got three parts around the foramen magnum. If that is the foramen magnum, in front of the foramen magnum is the basilar part, on two sides is the condylar part with jugular process, and behind the squamous part of the occipital bone. Okay. Now, jugular foramen. This jugular foramen is a large and elongated foramen with its long axis directed forward and medially, and it is placed at the posterior end of the petro-occipital suture. The jugular fossa is at the posterior end of jugular foramen. This is the jugular foramen. Jugular foramen. At the posterior end of the foramen, its anterior wall is hollowed out to form jugular fossa. So posterior end, there is a jugular fossa in the jugular foramen, which lodges the superior bulb of the internal jugular vein. So jugular foramen is actually made up by two bones, contribution by two bones. First, anteriorly, the petrous part of the temporal bone, which is a triangular bony projection from the temporal bone, form the anterior wall, petrous temporal, and posterior wall by the jugular part of the occipital bone. Okay. Now, the petrous temporal, at the posterior end of the foramen, the petrous temporal is hollowed out to form the jugular fossa. So see, there is a hollowing out of the petrous temporal. To form the jugular fossa. So foramen is a complete entity. Foramen is a complete entity, and jugular fossa is part of it. Okay. What are the structures that are passing through the jugular foramen? Now the jugular foramen, if we see the jugular foramen in isolation, The jugular foramen looks like this. This is the jugular foramen. It transmits the following features through the anterior part, inferior petrosal sinus and meningeal branch of the ascending pharyngeal artery. So that is the inferior petrosal sinus and meningeal part of ascending pharyngeal artery. Meningeal branch of ascending pharyngeal artery through the anterior part. Through the middle part, 9, 10 and 11 cranial nerves through the middle part. 3 cranial nerves, 9, 10 and 11. 9, 10, 11. Middle part. And through the posterior part, internal jugular vein and meningeal branch of the occipital artery. Actually, through the posterior part, what happens is that the sigmoid sinus, which is a dural venous sinus, it continues downward outside the jugular foramen as the internal jugular vein, and inferior petrosal sinus is its first tributary. So the sigmoid sinus within the skull, which is a dural venous sinus, it leaves the skull as the internal jugular vein. So internal jugular vein is actually the continuation of sigmoid sinus outside the jugular foramen. Okay. So these are the important structures that are passing through the jugular foramen. Now again, going back to the bony features. I told you about the jugular foramen, jugular fossa. Now the lateral wall of the jugular fossa, if we see the jugular fossa on the lateral side, the lateral wall of the jugular fossa is pierced by a minute canal, the mastoid canaliculus. So what is jugular fossa once again? First we make the outline of the jugular foramen. This is the jugular foramen. This is the petrous part of temporal bone, right? Petrous part of temporal bone. I told you that petrous part of temporal bone, part of the petrous part of temporal bone is hollowed out to form the jugular fossa. So that is the jugular fossa. This is the petrous part of temporal bone. This is the jugular fossa, and it is enclosed by the jugular process of the occipital bone to complete the jugular foramen. So jugular process of occipital bone is articulating something like this. And forming the jugular foramen. So this is the outline of the jugular foramen. This is the jugular process. Okay. Clear? Now the jugular fossa is the hollow part of the petrous temporal. Petrous temporal is a triangular projection from the temporal bone, and jugular fossa is a hollowed out part. The lateral wall of the jugular fossa is pierced by a minute canal, which is called mastoid canaliculus. Very small canal, lateral wall. It is called mastoid canaliculus. Near the medial end of jugular foramen, there is the jugular notch. Near the medial end of jugular foramen. foramen. There is a jugular notch. So here lies the jugular notch near the medial end of jugular foramen, jugular notch. Next is the styloid process. The styloid process is this one. Styloid process. Okay. Styloid process is a thin, long, solid, bony process of temporal bone anteromedial to the mastoid process, which is also a part of temporal bone, and below and behind the external auditory meatus. It is directed downward, forwards, and slightly medially, and it gives rise to a number of ligaments and muscles. On the lateral side of the styloid process, between the styloid process and the mastoid process, we get to see the stylomastoid foramen, which is situated posterior to the root of the styloid process. Okay. So let's see. This is the stylomastoid foramen. Between the styloid process, this one, styloid process, and this process is called the mastoid process. And in between them there is the foramen that is called stylomastoid foramen. Three muscles, stylohyoid, styloglossus, and stylopharyngeus, three muscles, and two ligaments, namely stylohyoid and stylomandibular. These structures are attached to the styloid process. The styloid process is located below and behind the external acoustic meatus. Below and behind the external acoustic meatus. External acoustic meatus is above it. This is the outline of the external acoustic meatus. It is viewed on the normal lateralis view or lateral view of the skull. The base of the styloid process is partly ensheathed by the tympanic plate. We'll see it later. The base of the styloid process. This is the tympanic plate, you will see. This curved plate of bone is tympanic plate, and the base of the styloid process is actually ensheathed by the tympanic plate. Base of styloid process, styloid process ensheathed by tympanic plate. Okay. So that is about the styloid process. Mastoid process, like styloid process, is also a component of the mastoid part of the temporal bone. It is a large conical process or projection located posterolateral to the stylomastoid foramen, and it forms the lateral wall of mastoid notch. See, there is a, this is the mastoid process, and the mastoid notch, there is a depression that is called the mastoid notch. It lies medial to the mastoid process. There is a styloid process. all are the parts of temporal bone. Stylomastoid foramen. What are the attachments? The mastoid notch gives origin to the posterior belly of digastric. So the mastoid notch, it is giving rise to the posterior belly of digastric muscle, posterior belly of digastric muscle. Okay, so these features pretty much describes the posterior part of the norma basilis. Okay. When the skull is viewed from its lateral aspect, it is called norma lateralis. It presents the following features. Nine bones form the norma lateralis, and they are frontal, parietal, occipital, temporal, sphenoid, zygomatic, mandible, maxilla, and nasal. All these 9 bones are joined by different sutures, and they are given different color codes for easier identification, and only the mandible among them is the mobile bone of the skull. The sutures seen on this aspect of the skull are as follows. Number 1, coronal suture. It is present between frontal and 2 parietal bones. It crosses the cranial vault from side to side. Number 2, parieto-squamosal suture. It is present between parietal and squamous part of temporal bones. And number 3, lambdoid suture. It is present between occipital and 2 parietal bones. Number 4, parieto-mastoid suture. It is present between parietal and mastoid part of temporal bone. And number 5, occipito-mastoid suture between occipital and mastoid part of temporal bone. Other features to be noted on the lateral aspect of the skull are as follows. Number 1, mastoid part of the temporal bone. The mastoid part of temporal bone lies just behind the external acoustic meatus. It is continuous antero-superiorly with the squamous temporal bone. A partially obliterated squamomastoid suture may be visible in front of and parallel to the roughened area for muscular insertion. The mastoid part of temporal bone articulates posterior-superiorly with the posterior-inferior part of the parietal bone at the horizontal parieto-mastoid suture, and posteriorly with the squamous part of occipital bone at the occipito-mastoid suture. These two sutures meet at the lateral end of lambdoid suture. The asterion is the point where perithomastoid, occipitomastoid and lambdoid sutures meet. In infants, the asterion is the site of the posterolateral or mastoid fontanelle, which closes by 12 months. The mastoid process is a breast-like projection from the lower part of mastoid temporal bone, posterior-inferior to the external acoustic meatus. It appears during the second year of life. The tympanomastoid fissure is placed on the anterior aspect of the base of the mastoid process. The mastoid foramen lies at or near the occipitomastoid suture. The external acoustic meatus opens just below the posterior part of posterior root of zygoma. Its anterior and inferior margins and lower part of posterior margin are formed by the tympanic plate. At the posterior-superior margin is formed by the squamous temporal bone. The margins are roughened for the attachment of auricular cartilage. The suprameatal triangle is a small depression posterior-superior to the meatus. It is bounded above by the supramastoid crest, in front by the posterior-superior margin of external meatus, and behind by a vertical tangent to the posterior margin of the meatus. The suprameatal spine may be present on the anteroinferior margin of the triangle. The triangle forms the lateral wall of tympanic or mastoid antrum. The zygomatic arch is a horizontal bar of bone formed by temporal process of zygomatic bone and zygomatic process of temporal bone. It presents two surfaces, outer and inner, and two borders, upper and lower. The upper border is continuous in front with the temporal line through the posterior superior border of zygomatic bone, and it is continuous behind with the supramastoid crest. The posterior end of lower border is marked by a tubercle called tubercle of root of zygoma. Here zygomatic process of temporal bone divides into an anterior and posterior roots. The anterior root is known as articular tubercle, which passes medially, forming anterior boundary of mandibular fossa, and the posterior root forms lateral boundary of mandibular fossa and terminates behind into a small post-glenoid tubercle. The temporal lines commences at the frontal process of the zygomatic bone arches upwards and backwards across the parietal bone, where it splits into superior and inferior temporal lines. Traced behind, the superior temporal line fades away, whereas the prominent inferior temporal line curves downwards and forwards across the squamous part of temporal bone as the supramastoid crest, which is continuous with the superior root of zygomatic process. Boundary of temporal fossa: above by the superior temporal line, below by the upper border of zygomatic arch laterally, and by the infratemporal crest of greater wing of sphenoid bone medially. Through the gap deep to the zygomatic arch, temporal fossa communicates with the infratemporal fossa. The anterior wall is formed by the zygomatic bone and by parts of frontal and sphenoid bones. This wall separates the fossa from the orbit. Floor: the anterior part of the floor is crossed by an H-shaped suture where four bones, frontal, parietal, greater wing of sphenoid and temporal, adjoin each other. This area is termed the terion. It lies 4 cm above the midpoint of zygomatic arch and 2.5 cm behind the frontozygomatic suture. Deep to the terion lie the middle meningeal vein, the anterior division of middle meningeal artery, and the stem of the lateral sulcus of brain. When the skull is viewed from its lateral aspect, it is called norma lateralis. It presents the following features. Nine bones form the norma lateralis, and they are frontal, parietal, occipital, temporal, sphenoid, zygomatic, mandible, maxilla, and nasal. All these 9 bones are joined by different sutures, and they are given different color codes for easier identification, and only the mandible among them is the mobile bone of the skull. The sutures seen on this aspect of the skull are as follows. Number 1, coronal suture. It is present between frontal and 2 parietal bones. It crosses the cranial vault from side to side. Number 2, parieto-squamosal suture. It is present between parietal and squamous part of temporal bones. And number 3, lambdoid suture. It is present between occipital and 2 parietal bones. Number 4, parieto-mastoid suture. It is present between parietal and mastoid part of temporal bone. And number 5, occipito-mastoid suture between occipital and mastoid part of temporal bone. Other features to be noted on the lateral aspect of the skull are as follows. Number 1. Mastoid part of the temporal bone. The mastoid part of temporal bone lies just behind the external acoustic meatus. It is continuous anterosuperiorly with the squamous temporal bone. A partially obliterated squamomastoid suture may be visible in front of and parallel to the roughened area for muscular insertion. The mastoid part of temporal bone articulates posterosuperiorly with the posterior-inferior part of the parietal bone at the horizontal parieto-mastoid suture and posteriorly with the squamous part of occipital bone at the occipitomastoid suture. These two sutures meet at the lateral end of lambdoid suture. The asterion is the point where parieto-mastoid, occipito-mastoid and lambdoid sutures meet. In infants, the asterion is the site of the posterolateral or mastoid fontanelle, which closes by 12 months. The mastoid process is a breast-like projection from the lower part of mastoid temporal bone, posterior-inferior to the external acoustic meatus. It appears during the second year of life. The tympanomastoid fissure is placed on the anterior aspect of the base of the mastoid process. The mastoid foramen lies at or near the occipito-mastoid suture. The external acoustic meatus opens just below the posterior part of posterior root of zygoma. Its anterior and inferior margins and lower part of posterior margin are formed by the tympanic plate. At the posterior-superior margin is formed by the squamous temporal bone. The margins are roughened for the attachment of auricular cartilage. The suprameatal triangle is a small depression posterior-superior to the meatus. It is bounded above by the supramastoid crest, in front by the posterior-superior margin of external meatus, and behind by a vertical tangent to the posterior margin of the meatus. The suprameatal spine may be present on the anteroinferior margin of the triangle. The triangle forms the lateral wall of tympanic or mastoid antrum. The zygomatic arch is a horizontal bar of bone formed by temporal process of zygomatic bone and zygomatic process of temporal bone. It presents two surfaces, outer and inner, and two borders, upper and lower. The upper border is continuous in front with the temporal line through the posterior-superior border of zygomatic bone, and it is continuous behind with the supramastoid crest. The posterior end of lower border is marked by a tubercle called tubercle of root of zygoma. Here zygomatic process of temporal bone divides into an anterior and posterior roots. The anterior root is known as articular tubercle, which passes medially, forming anterior boundary of mandibular fossa, and the posterior root forms lateral boundary of mandibular fossa and terminates behind into a small post-glenoid tubercle. The temporal lines commences at the frontal process of the zygomatic bone, arches upwards and backwards across the parietal bone, where it splits into superior and inferior temporal lines. Traced behind, the superior temporal line fades away, whereas the prominent inferior temporal line curves downwards and forwards across the squamous part of temporal bone as the supramastoid crest, which is continuous with the superior root of zygomatic process. Boundary of temporal fossa: above by the superior temporal line, below by the upper border of zygomatic arch laterally, and by the infratemporal crest of greater wing of sphenoid bone medially. Through the gap deep to the zygomatic arch, temporal fossa communicates with the infratemporal fossa. The anterior wall is formed by the zygomatic bone and by parts of frontal and sphenoid bones. This wall separates the fossa from the orbit. Floor: the anterior part of the floor is crossed by an H-shaped suture where four bones, frontal, parietal, greater wing of sphenoid and temporal, adjoin each other. This area is termed the terion. It lies 4 cm above the midpoint of zygomatic arch and 2.5 cm behind the frontozygomatic suture. Deep to the terion lie the middle meningeal vein, the anterior division of middle meningeal artery, and the stem of the lateral sulcus of brain. Norma frontalis: in frontal view, the skull appears oval, being wider above and narrower below. The anterior aspect of the skull presents the following features. Number 1. Frontal region formed by the frontal bone. Number 2. Orbital openings. Number 3. Prominences of the cheek formed by zygomatic bones. Number 4. Bony external nose and anterior nasal aperture. And number 5. Upper and lower jaws bearing teeth. So first point is the frontal region formed by the frontal bone. The frontal region or the forehead is formed by the squamous part of the frontal bone. Below, on each side of the median plane, it articulates with the nasal bones. Frontal region represents the following features: superciliary arches, glabella, and frontal eminences. The superciliary arch is a rounded, curved elevation situated just above the medial part of each orbit. It overlies the frontal sinus and is better marked in males than in females. Number 2, the glabella. It is a median elevation connecting the two superciliary arches. Below the glabella, the skull recedes to frontonasal suture at root of the nose. Number 3, the nasion. It is a median point at the root of the nose where the internasal suture meets with the frontonasal suture. And number 4, the frontal tuber or eminence is a low rounded elevation above the superciliary arch, one on each side. It is more prominent in females and in children. Next important landmark is the orbital openings. These are the openings of two orbital cavities on the face. Each opening is present above and lateral to the anterior nasal aperture. It is quadrangular in shape and presents four margins: supraorbital, lateral, infraorbital, and medial margins. First, the supraorbital margin. The supraorbital margin is formed entirely by the frontal bone. At the junction of its lateral 2/3 and medial 1/3, there is a notch called supraorbital notch or supraorbital foramen in some skulls, through which passes the supraorbital nerve and vessels. Second point is the lateral orbital margin, which is formed by the frontal process of zygomatic bone and zygomatic process of frontal bone. 3. The infraorbital margin. It is formed by the zygomatic bone laterally and the maxilla medially. Below this margin, the maxilla presents an opening called infraorbital foramen, through which passes the infraorbital nerve and vessels. 4. The medial orbital margin. It is ill-defined as compared to the other three margins. It is formed by the frontal bone above and the anterior lacrimal crest of the maxilla below. Prominences of the cheek are formed by zygomatic bones or malar bones. Each prominence is situated on the lower and lateral side of the orbit and rests on the maxilla. It is marked by a foramen called zygomaticofacial foramen. Next is the bony external nose and anterior nasal aperture. The bony external nose is formed by the nasal bones, there are two of them, and maxillae. It terminates in front and below as piriform aperture of the nose called anterior nasal aperture, which is bounded above by the nasal bones and laterally and below on each side by the nasal notches of the maxillae. The two nasal bones articulate in the midline with each other at internasal suture. Posteriorly with frontal processes of maxilla and superiorly with frontal bone at the frontonasal suture. Anterior nasal spine is a sharp bony projection which marks the meeting of the two maxillae in the lower boundary of the anterior nasal aperture. Upper and lower jaws. The upper jaw is formed by the two maxillae. On the anterior aspect of each maxilla presents a zygomatic process which extend laterally and articulate with the zygomatic bone. B. A frontal process which project upwards and articulates with the frontal bone. C. An alveolar process which carries the upper teeth. And D. The anterior surface of the maxilla which presents nasal notch medially, infraorbital foramen 1 cm below the infraorbital margin, incisive fossa above the incisor teeth, canine fossa which is lateral to the canine eminence produced by the root of canine tooth. The lower jaw is formed by the mandible. The upper border, also called alveolar process of the mandible, carries the lower teeth. Mandible will be described later. Then the bones and sutures of the norma frontalis. As discussed, the following bones are seen when skull is viewed from the front. Number 1, frontal bone forming the forehead. Number 2, nasal bones, right and left, forming the bridge of the nose. Number 3, maxillae, right and left, forming the upper jaw. Number 4, zygomatic bone, right and left, forming the malar prominences. And number 5, last but not the least, mandible, forming the lower jaw. The sutures seen in this view are as follows: 1, frontonasal, 2, internasal, 3, frontomaxillary, 4, zygomatico-maxillary. Other features. In addition to the above, the following features should be noted in the median plane and lateral region of the anterior aspect of the skull. First, in the median plane. 1. Glabella. It is a median elevation above the nasion and between the superciliary arches. Number 2, nasion. A median point at the root of the nose where the internasal and frontonasal sutures meet. Number 3, anterior nasal spine. A sharp bony projection in the median plane in the lower boundary of the pyriform aperture. Number 4, symphysis menti, a median ridge joining the two halves of the mandible. Number 5, mentral protuberance, a triangular elevation at the lower end of symphysis menti. And 6, mental point, which is the middle point of the base of the mandible. Also in the lateral region from above downwards in the norma frontalis, the following features can be seen. Number 1, frontal prominence, a low rounded elevation above the superciliary arch. Then 3 foramina lying in the same vertical plane. First, supraorbital notch or foramen at the junction of medial 1/3 and lateral 2/3 of the superior orbital margin. 2. Infraorbital foramen 1 cm below the infraorbital margin. 3. Mental foramen below the interval between two premolar teeth. And an oblique line on the body of mandible extending between the mental tubercle and lower end of anterior margin of the ramus of the mandible can be seen on the norma frontalis view. So that is all about norma frontalis. When the skull is viewed from above, it appears oval, being wider posteriorly than anteriorly, and such a view is known as norma verticalis. So norma verticalis is the view of the exterior of the skull from above. Apart from the norma verticalis view, we also get 4 other types of view, which are known as norma frontalis, norma lateralis, norma basalis, norma occipitalis, and we will discuss all the views one after another. Now we are concentrating on the norma verticalis. The norma verticalis presents the following features. First, bones and sutures. The bones forming the norma verticalis are frontal, parietal, occipital. 3 bones. 3 bones are taking part, and these 3 bones are located as follows. The frontal bone, it is lying anteriorly. Parietal bones, there are 2 of them. They lie on either side of the midline. And occipital bone, it lies posteriorly. These bones are united by the following 3 sutures. Number 1, coronal suture. It is a suture between frontal and 2 parietal bones. It crosses the cranial vault from side to side. Number 2, sagittal suture. It lies between 2 parietal bones and it lies in the median plane. Number 3, lambdoid suture. It lies between occipital and 2 parietal bones. It is shaped like the letter lambda, hence its name. Important point to note that the metopic suture is occasionally present in the median plane of the frontal bone in 3 to 8% cases. It represents the remnants of suture between the 2 halves of the frontal bone in fetal skull, which develops by separate centers of ossification. Isolated sutural bones ossified from separate centers are also often seen along the lambdoid suture. Such bones are known as Ormian bones or interparietal bones. Other features are as follows. Number 1, bregma. Bregma is a point at which coronal and sagittal sutures meet. So the meeting point of coronal and sagittal sutures are known as bregma. Number 2, parietal eminence or tuber. It is an area of maximum convexity of parietal bone. Number 3 is the vertex. It is the highest point on the skull. It lies on the sagittal suture near its middle and is situated a few centimeters behind the bregma. Number 4, Parietal foramen. It is a small foramen in parietal bone near sagittal suture, 2.5 to 4 cm in front of lambda. And 5. Obelian. It is a point on sagittal suture between the two parietal foramina. So all these points, all these features perfectly describe the norma verticalis, which is the view of the exterior of the skull when the exterior is seen from above. Norma occipitalis. When the skull is viewed from behind, it appears convex upwards and on sides, but it is flattened below. It presents the following features. Number 1. Bones and sutures. The bones seen in norma occipitalis view are posterior portions of parietal bones, the upper part of occipital bone, and mastoid parts of temporal bones. They are located as follows. Number 1. Parietal bones, superiorly, one on each side. Number 2. Occipital bone, squamous part of occipital bone. It is present inferiorly. And number 3. Mastoid part of temporal bone, inferolaterally on each side. The sutures which unite these bones are as follows. Number 1. Lambdoid suture between occipital and two parietal bones. Number 2. Occipitomastoid suture between occipital and mastoid part of temporal bone. And number 3. Parieto-mastoid suture between parietal and mastoid part of temporal bone. Other features. The other features to be noted on the posterior aspect of skull are: number 1. Lambda. It is the point at which sagittal and lambdoid sutures meet. Number 2. External occipital protuberance. It is a median bony projection about midway between the lambda and the foramen magnum. The most prominent point of external occipital protuberance is called inion. Number 3. Superior nuchal lines. These are carved bony ridges passing laterally on each side from external occipital protuberance. In some cases, carved faint bony ridges are seen 1 cm above the superior nuchal lines, and they are called highest nuchal lines. Number 4. External occipital crest. It is a vertical ridge between the external occipital protuberance and posterior margin of foramen magnum. Number 5. Inferior nuchal lines. These are curved bony ridges passing laterally on each side from middle of the external occipital crest. And number 6, mastoid foramen. It is present near the occipito-mastoid suture. So we get three sets of nuchal lines. Number 1, highest nuchal line, most superiorly. Down to it is the superior nuchal line, and till further down, inferior nuchal lines. We get an external occipital protuberance, which is a median bony projection, and an external occipital crest, which is a vertical ridge between the external occipital protuberance and the posterior margin of foramen magnum.